Hi, I'm Dr. Ariel Wynn. I'm a pelvic floor physical therapist in Chicago, Illinois, and today we are going to be talking about constipation and Parkinson's disease. So, Parkinson's disease is generally associated with freezing and rigidity and slow movements, and we can find that that also affects the colon. There are also some medications that are used with Parkinson's that can further exacerbate some of that constipation. So things like calcium supplements or narcotic pain medications, those can all have a side effect of constipation as well as the disease is oriented towards constipation. So one of the reasons we worry so much about constipation is, as many people know, it is uncomfortable and it is interfering with daily life activities a lot of times, but also we find that it decreases the effectiveness and absorption of levodopa, which is one of the main medications we use to treat Parkinson's. So that's one of the reasons that constipation is such a big topic in Parkinson's disease, because it can change the way the disease is progressing. So as a pelvic floor physical therapist, I treat constipation very often. Usually I am focused on the muscle movement, on breathing and body mechanics while you're having a bowel movement, but I want to talk today a little bit about some of the other behavioral things that could be helpful. So the first one that we're going to talk about is water intake. So hydration is probably one of the first things your doctor will recommend. We usually say make sure you're getting between 6 and 8 glasses of water. We also recommend trying to have warm liquids in the morning when you're more likely to have a bowel movement, because it can help stimulate that reflexive movement. We also recommend avoiding alcohol because that can dehydrate you and actually make it less likely for you to have a bowel movement. Coffee is kind of a coin toss. You'll hear a lot of people say to avoid it because it's dehydrating, but also you'll have a lot of people who say it helps them have a bowel movement. So listen to your body. If you find that coffee is helpful, as a physical therapist, I recommend doing a water sandwich around your coffee. So having a glass of water, your glass of coffee, and then another glass of water, just to kind of dilute that diuretic effect and to prevent some of that dehydration that could sometimes happen. I know I can't live without my cup of coffee, so that's something that I would recommend for myself. So if you're like me, that's one technique you can try, or you can try switching to tea or something that's a little bit less dehydrating. Next, we're also going to talk about food. So that's another thing that you'll hear people talk about. So you're going to want to increase your fiber intake. Usually we recommend increasing this gradually, so you don't want to eat a lot of fiber all at once because that can cause gas and pain and discomfort. So we want to increase it gradually. You're going to want to look at things like whole fruit with the skins, because that's going to have a combination of soluble and insoluble fiber, and your body needs a little bit of both. You can also use supplemental fiber. So things like stool softeners are usually a really good option. There's also supplemental fibers like psyllium husk. Your doctor may also recommend over-the-counter laxatives or enemas if the constipation is getting severe, but we generally don't want you using those on a daily basis. We also recommend having small meals throughout the day. So rather than having one large meal for breakfast, one large meal for dinner, one large meal for lunch, you can have smaller meals throughout the day, because that will kind of influence the motility of your colon. Next, we're going to talk about where physical therapy really shines. So the more you are up and active and moving around, the better your colon will be moving. So we want to make sure that you're safe. So we want to make sure that you're not falling or having any increased injury risk. So make sure that you're using any assisted device that your doctor recommends. Make sure that you are with somebody who could help you up should you fall. And also make sure that if you are having pain in any part of your body, knee, hip, back, that you are addressing that with physical therapy, because that physical therapist can also help you work on balance and transfers and increasing your gait speed so that you're not having those freezing, rigid steps that can sometimes increase your risk of falling. So I hope that this initial video was helpful. In the next couple videos, we're going to look at other pelvic floor physical therapy techniques that I use, like abdominal massage and breathing and the squatty potty and all those types of things. So stay tuned for future videos and follow me so that you don't miss anything.